prescribe medication, so they can't say, oh, if they have this infection, they need this antibiotic, or any treatment. All of those orders have to come from the veterinarian. They can't prognose patients. Does anybody know what prognose means, or prognosis? Prognosis just means, what is the outcome going to be? So a vet tech can't go in and say, it's going to be okay, your dog's going to be fine, or not. So that's also part of the veterinarian's job. In Kansas, at least, vet techs cannot vaccinate for rabies. They can give other vaccinations, but they are not supposed to give the rabies vaccine. From the experience I had in vet tech teaching veterinary technicians, I do think that happens some, but for the most part, veterinarians are supposed to do that vaccination. So vet techs and veterinarians alike, we are all dental hygienists, surgical technicians, radiology technicians, anesthetists, lab techs, pharmacy techs, nurses. We do it all right? So this is just a short list of some of the things that a vet tech does do. They're in charge of everything, really. Patient care is probably their priority. Their most important part of their job is that patient care, patient advocacy. They are there to let us know how our patients are doing. Very similar to a nurse in a hospital, so a human nurse. And actually, veterinary technicians are working on changing their name. They might not continue to be called vet techs. They might eventually be veterinary nurses. So that change is kind of in the works. So all of these things, they are in the lab, they're taking x-rays for us, they are in charge of monitoring for anesthesia. They don't come up with the anesthetic plan, but once we give the anesthetic, they are responsible for monitoring that patient, making sure that they stay at a good plane of anesthesia. They are very multitasking and multi-trained individuals in a vet clinic. You'll see the receptionist could be a vet tech, or at least if the phone's ringing, vet tech's going to answer it if the receptionists are busy. They are cross-trained around in the entire hospital. So they're a very vital part of hospital for sure. So you've seen these before, right? What my friends think I do, you know, veterinary medicine is not all puppies and kittens. It would be great if it was. Everybody would want to do it if it was puppies and kittens, right? What my mom thinks I do, what society thinks I do, and we do a lot of that. Veterinary medicine is not glamorous. I tell people that all the time. It is down and dirty, hard work, but it's very gratifying and very fun. What my boss thinks I do, I just cuddle all day. What I think I do, which is exactly what vet tech does, assist the veterinarian all day long, and what they actually do. Veterinary technicians, I could not really believe it when I started teaching in a vet tech program, everything they had to learn. They learn everything that veterinarians learn, just not quite as in-depth. And we'll get into that. I kind of put some slides in there about what classes you take in vet tech school and what classes you take in vet school. So the veterinarian, anything that we listed for vet techs, the veterinarian does all of that too. There are many veterinarians who don't even employ a veterinary technician. So they do a lot of their own lab work, all of their own x-rays, cleaning up, patient care falls on them if they don't have a vet tech in their hospital. There are hospitals that will train people. So even if you haven't gone to vet tech school, they will train people on the job to do a lot of things that a veterinary technician does. So that possibility is there too, but for the majority, it's very good to have that baseline knowledge, go to a vet tech program to learn why you're doing the things that the veterinarian teaches you how to do. So, and then those other things that we talked about, surgery, diagnosing patients, prescribing treatments and medications, prognosing patients, making those final decisions for both pets and pet owners, and also business decisions. The veterinarian is usually the practice owner, so they also have to manage all the business that goes along with running a clinic. Okay, so since we know that, who do you think is doing this up here? Is that a veterinarian or a vet tech? Or which one's which? Which one do you think this is? The vet, right. Who's this?
The vet.
Right. Who's this? Monitoring a patient, checking anesthesia.
The vet.
Vet tech. How about this? Working in the lab. Vet tech. Veterinarians can be in there too, but for the most part, lab work, well, we rely on our technicians to help us get to a diagnosis through the lab. How about this? Checking herd health. Veterinarian. We do use veterinary technicians in large animal medicine, and actually we're always working to try to get them to be able to do more in large animal practices because we're kind of in short supply of large animal veterinarians, so technicians could help them more. How about this is floating a horse's teeth. Horses' teeth grow continually, so we actually have to kind of shave down, grind down their teeth for them. Who might do that? The veterinarian. I hadn't mentioned this yet, but this is another job opportunity for veterinarians. Many veterinarians work for the USDA, and any meat that you buy in the grocery store has been investigated and inspected by a veterinarian. So that's a veterinarian, I'll give you that one. Veterinarians also work in the military. I'm sure they also employ vet techs. I didn't really ever have any students go into that, but I'm sure that there are. Okay, same thing here. Who is doing surgery? Right. Who's prescribing medications? Who is cleaning an animal's teeth? The vet tech, right. Yep, that's a really big part of their job. Who's giving an animal medication? Or the vet tech. Both of them, absolutely. Vet tech is in charge of all the treatments in the hospital generally. So vet techs, but veterinarians do that too. This is a urinalysis strip. You might be looking at a urinalysis. Vet tech. This is a blood smear. Who would be looking in a microscope at a blood smear? Yep, the vet tech. This is actually a fecal float, so full of parasite eggs. Who might be looking at that? Vet tech. And the last one, working on a ration for cattle. So trying to teach the producer what the animals should eat. Who would be doing that?
The vet.
The veterinarian. Yep, exactly. All right. So education-wise, veterinarians generally have 3 to 4 years of undergraduate work. If you guys picked up an early admit sheet there, early admit students can actually apply their senior year of high school or their first year of college. And as soon as they finish the prerequisites, which for us that's 64 credit hours, they can actually apply for vet school. So the early admit students actually can apply the spring semester of their senior year of high school or the first year of college. So, and then have a guaranteed spot. Yeah, so that flyer gives you a little more information about that. So 3 to 4 years of undergrad, 4 years of vet school on top of that. And then we take a national board exam. We also take a state exam. Each state gives their own exam, but the national exam is for all states. If a veterinarian wants to specialize, and later on I have a list for you of all the different specialties available, that requires further education. Even after you get your Doctor of Veterinary Medicine, you do an internship in whatever you're interested in, and then a 3 or 4 year residency to become board certified. So board certified veterinarians, that's who works at the vet school. They work at referral hospitals or specialty clinics. So in our hospital, we will have any human doctor you could think of. We have that specialty in veterinary medicine. We have ophthalmologists and dermatologists and internal medicine specialists and orthopedic surgeons, and they have all gone through this further education to become specialized in that certain area. Vet tech education, really we just have to be a high school graduate or have a GED, and then go to 2 years at a technical college. In Kansas City, the one that I know of is Maple Woods. I'm not sure if there are others in Kansas City or not, but that is the one I know that's here. Vet tech students also have to take a national board exam. and it's hard. It is hard. I've prepared a lot of students to take that exam, and we just kept our fingers crossed that day they were taking it. It is a very challenging exam. And then they also need to get a state license. So you hear of registered veterinary technicians or licensed or certified, those they have gone through this process. Vet techs can also specialize, which is fantastic for them, and we have many of those at K-State too. Veterinary technicians who only do anesthesia. They are specialized in anesthesia, dermatology, exotics, you name it, there's a specialty. So I listed some of those. So these are the veterinary specialties. And then the vet techs, actually, they name theirs a little differently. They call them either a society or an academy as far as their specialty goes. So societies actually are just individuals that are interested, and it can be really anybody on the staff at a vet hospital, supported by an existing specialty. So if there's a vet assistant who's interested in surgery, they can join a society. It doesn't really take an extra test or anything like that. They can just say they're interested, probably pay their dues, and they're in. Versus an academy, academies are for veterinary technicians. So this is the vet tech's area of specialty. They have, and every academy is a little bit different, but most of these vet techs have to work with a specialist in the area of interest. They have to write case reports, so they have to follow the case from the beginning to end and write up all the research and everything that went along with diagnosing the case. And then they have to take a national board exam to become specialized. So it is usually about a 5-year process for vet techs to become specialized. Yes.
So when you talk about the specialization, or and maybe this is the specialization part, but when you talk about, you know, small animal vet, large animal vet, exotic, where do you start? Is that as part of the 4-year vet education?
Yes.
Okay.
Yep. So 4 years of veterinary education at Kansas State. Our students are educated on every species. So some vet schools will track. So if you start vet school and say, I'm really interested in horses, they will allow those students to really study everything equine. And I'm sure they get exposed to some of the rest of it, but not as in depth. All of our students take every class. Their senior year, they go through all of the rotations. So they're a very well-rounded veterinarian when they graduate from K-State. Which means they can go out and practice pretty much anywhere.
They can decide to kind of specialize then after that.
Yes. The place that we do allow them to specialize a little bit during school is with electives. So each semester, students have a list of electives that they can choose from. And so some of them might choose to take an exotics elective if they're interested in that, or a large animal elective. And then the 4th year, there are rotations where they can go through and spend 6 more weeks in large animal if they're interested in that. But when you graduate from vet school, you can go right out into practice without being specialty. Good question. Anybody else? So this is the list of vet tech academies. So as you can see, there are a lot of areas where vet techs can specialize also. But same thing, when they graduate from school, if they want to go into a small animal practice and just be a general vet tech, they can do that. Okay, and then there's the list of societies. So like I said, anybody in a clinic can be a member of the society. Okay, so that was all really fun. The cost of education is where things get a little more challenging because a lot of us have dreamed about being veterinarians since we were little kids. And I've talked to a lot of students since I've been at K-State, and they are all aware of the cost, but they don't really care about the cost where they need to. All they see is that dream job, and they will do anything to get there. But the challenge with that is what it costs. This is straight off of our website, so off of the K-State website. Our in-state students, this is their tuition, almost $25,000 a year. And these are the non-resident students. At K-State, we have 50 students from Kansas and about 62 non-resident students. So we know it's a challenge to pay that tuition. K-State has done everything we can do to try to reduce that for our students. We have frozen tuition. So we are not raising tuition. And that has put us in about the middle of the pack as far as the 30 veterinary colleges in the United States. We're kind of average as far as our out-of-state costs. And then just room and board, all the other costs that go along with school. I had to search for a long time to try to find somebody to tell me how much it costs to be a vet tech, but I did finally find it. So veterinary technicians, that 2-year degree will cost about $30,000. One position I haven't talked about yet is veterinary technologist. It's a little different than a technician. A technician goes to a 2-year school. A technologist does go to a 4-year school, and they have a bachelor's degree. The technician will just have an associate's degree, generally. Technologist, $67,000 to $86,000 for that 4-year degree. So I put just a few different facts from veterinary economics on here too. And these are a little old, but this is from 2014. And just the amount of debt that students have when they graduate from vet school. So the largest majority of students are anywhere from $40,000 to $50,000, almost up to $200,000 in debt when they graduate from vet school. And this one, I put this on here just to show you what veterinarians do. That's not very clear, but small animal practice, large animal practice, research, exotic animal medicine. But the big blue is the small animal practitioners. Okay, this is kind of small too, but I just wanted to give an example of what classes vet techs take. So they do take surgical nursing, so they don't learn surgery, but they learn how to prep, take care of all the equipment. They learn how to position patients for surgery, how to recover patients from surgery, watch out for animal welfare, notice if an animal's in pain, all those things. Practice management, because many veterinary technicians will also function as a practice manager, do a lot of the ordering and have some oversight of other staff members. Anatomy and physiology, of course, technical math or medical math, radiology, microbiology, another class in nursing, and then clinical skills, and then also lab classes, pharmacology. So even though they're not prescribing the medications, they need to know why we're giving certain medications. They need to know how those medications are metabolized and how animals get rid of them. And some of it is really for a second check on the veterinarian too. Vet clinics are busy places. Everybody's human, so sometimes mistakes are made. So if we have another educated person there that says, now this dog had kidney failure, so we can't use this drug, right? So we just have that teamwork that goes into taking care of those patients. Large animal nursing, internships. So we do send vet tech students out into a clinical setting once they've had a good part of their education. In my program, we did all of these at the very end. So they had all their classes, and then they went out to externships. This was just an example where they do one rotation between years of education. So kind of get an idea there. There are some kind of prerequisite classes in their speech and some English composition. Veterinary technicians need to know how to keep medical records. They need to have very good writing skills. They need to have very good verbal skills. They are going to be a big part of client education, so they need to be able to talk to people and in a way that they can understand. And then the veterinary curriculum. So this is year 1, and at least at K-State, we study everything normal in the first year. So we learn normal anatomy, normal physiology, so we have that base of what's normal for animals to lead into our second year. And second year is all the ology year, I call it. It's all the abnormals, parasitology, pathology, pharmacology, virology. You hear the ologies. So it is the year of abnormal things. And then the third year is a lot of the clinical practice and large animal. And the other thing that I should mention, and they're on each one of these, but our students, the third year also is our clinical year. So students are learning clinical skills, surgery, physical exam skills, those sorts of things. K-State, we've changed that a little bit, and now our students are starting that in their first year. So every semester they will have a clinical skills lab, which by the time they get to their fourth year, they're going to have all the skills those clinicians want them to have. They can step right into the clinics, step right into practice, and be very well trained in their clinical skills, which are so important. And then this is the fourth year. So these are all of the rotations that veterinary students go through at our hospital. The majority of them are on our campus, although they have 11 semester hours of electives. And this is where they can choose if they want to do more large animal or equine. They can go home and do these electives with their veterinarian in their hometown if they want to. We have students go to other vet schools and go through rotations there. For instance, if somebody's interested in marine animals, they can go to University of Florida for one of those rotations. So the possibilities really are endless. You do have to apply, and your elective clinic has to be approved, but for the most part, we want our students to have those varied experiences. Okay, so we talked about the price of education. Now we need to talk about the income once you graduate, because that's where that challenge comes. So lots of other doctors that you might know, if they practice in human medicine, their education costs pretty much the same as getting a DVM, but their potential to make money after they graduate is higher than what a veterinarian is. And one of the reasons for that is that our businesses are really cash basis. We don't have health insurance like human side does. It's available, and there are people who do own pet health insurance. And it does help them with that cost, but that's why our income is lower. So veterinarians average from $65,000 to $106,000 a year, and that's for general practitioners. Those specialty veterinarians we talked about, they do have the potential to make more than that. In Kansas, average is $77,000, so salary for a veterinarian. Vet techs, $25,000 to $36,000, and in Kansas, the average I found was $28,000, $29,000 a year. So you can see those two things are not very proportional. So that's our challenge. That's a big challenge right now for us. And the cost of education, not just for veterinarians, but for everybody, has just continued to go up and up. So we just look for ways to reduce the cost as much as we can for our students. I mentioned we froze tuition. We've also taken away all the extra fees. Those of you who went to college, you know what I'm talking about. Every class you enroll in, you have a fee for this, you have a fee for that. So we have done away with the majority of fees also, just to try to make things as affordable as possible for our students at Kansas State. So the dark blue here is debt, and the dark green here is income. So we have a ways to go. Yes.
Not to interrupt. I don't know if you're ready for the question. So you had said that there's 3 to 4 years of undergraduate and then 4 years of vet school, correct? Mm-hmm. So the last slide that you showed, that was the vet school. That was the curriculum for the actual 4 years of postgraduate. Yes. So what kind of undergraduate degrees do people typically get when they're going into vet school? Students
can really get any undergraduate degree that they want.
So would they want to get like a vet tech degree and then maybe go forward, or?
Not necessarily. There are veterinary technicians who then do apply and get into vet school, so that's certainly one route. But many students, if you're trying to limit your education and you want to go to vet school, you can finish those 64 hours of prerequisites. So that's the chemistries, biology, microbiology, genetics, that are listed on the major sheet. Once you finish those prerequisites, or really the year before you finish them, you can apply for vet school. So students who are enrolled at K-State in undergrad and get in after that third year, they haven't finished a bachelor's degree. Once they're in vet school, we do a reverse transfer to help them get that bachelor's degree. So we do have that as long as their undergrad has been done in K-State. Okay, so they can get a bachelor's degree. There was one other thing I was just going to say about that. Oh, no, it's gone. No, that's okay. Oh, what I was going to say is their field of study doesn't matter to us. We have students who have engineering degrees and get into vet school. We have students go through animal science, of course, so the College of Agriculture. A lot of our students come through that. The College of Arts and Sciences, so students who, if they don't get into vet school after that 3rd year, they'll get a biology degree or they'll get a chemistry degree. We don't have a requirement, that says you have to have this type of bachelor's before you can get into vet school. So we like that kind of diversity in our class in different levels of education. And really the engineering student, I'm kind of excited to see what she does. Yeah.
So when you're saying after the 3rd year, if you can go ahead and apply and get accepted, but you do kind of reverse to kind of get them a bachelor's degree.
Right.
Is that just considered like a pre-vet bachelor's? I mean, like what is that kind of considered?
It'll be whichever college they were enrolled in their undergrad. So if they were in the College of Agriculture, they'll get a bachelor's of science from the College of Agriculture. Arts and Sciences, they'll get a bachelor's of arts and sciences from the arts and sciences. So it just depends on what they were enrolled in, as long as they meet all of the requirements of the undergraduate degree also.
So if you were going to recommend, somebody who, that's their plan. They're going to say, I'm going to go into school, I'm going to get these 64 credits of prereq, I'm going to apply, I'm going to make it. Which would be the best way for them to go? Like which school,
It doesn't matter. They need to take classes that they're interested in. And they have to have a plan B. So, there are a lot of students who don't get in on their first try. We want them to be set, so then the next time that they apply, they're finishing their bachelor's degree. So we definitely want students to be smart about, what they choose to study and what their plan B is in case that first application is not successful.
I just think that's kind of the same conversation we've been having is what is the good kind of base thing to be thinking about.
Right.
But if you know that you're going to go that way, is there a better way to think about your process? Is there a better way?
No, and it's not like
Focus yourself.
it's not like we have a preference. So it's really the student's interests that's the area that they should study in. Okay. There are some great resources online, and this is actually an interactive map. I just copied the picture of it. But you can float over states and see averages. You can see some of these maps even have the cost of all the different vet schools. But this one is the annual mean wage. So you can see on our coasts, those veterinarians where there's a higher cost of living also have the potential to have a higher income. And this is employment of veterinarians. How many veterinarians live in Kansas? So 400 to 860 veterinarians in the state of Kansas. Again, those coasts where we have a higher population, there are going to be more veterinarians there. As far as employment, if a veterinarian wants to work, they can work. There are jobs out there. Same with a veterinary technician. I had people calling me all the time from anywhere in Kansas saying, I really would like to hire a vet tech. And we just couldn't produce enough students really for all the jobs that were out there. Now, if you say, I want to live in Olathe and I want to work on this corner in this hospital, if that hospital is not hiring, that might not be possible. So you do have to be willing to be a little flexible, go where the jobs are, but they're definitely available. Oh, and that leads right into this. So veterinarians and veterinary technicians, job growth off the charts compared to a lot of other professions. And really both areas need to try to keep up with the human population. Our human population is growing so fast. And what do we need? If the human population is growing so fast, why would we need more veterinarians?
More pets.
More pets, absolutely. What other type of animals do veterinarians take care of that would be important?
More livestock.
Livestock, yes, food, right? That's a very important job of veterinarians, is keeping our food healthy and available. So absolutely, veterinarians are going to play a very important role in keeping up with keeping our food supply healthy. Okay, so like I said, yes, plenty of animals out there need veterinarians to take care of them. And this is what I was talking about, current population. I found this, I just thought it was amazing. So it took us 300,000 years to reach the first billion people on Earth. And then the succession, only 130 years to get 2 billion, 30 more years to get to 3 billion. You can see how fast human population is multiplying. So that food supply just becomes more and more important. And our One Health is one thing that we focus on too. So One Health, as you can see, it's people, healthy animals, healthy environment. Those three things are so interconnected. It's important to keep all three areas healthy. So veterinarians play a very important role in One Health. I couldn't have done my job without the vet techs that I work with. They can't do their job without the vet assistants. None of us can do our job without the receptionists. So it is absolutely a team. There's not one person that's more important. Like I said, all the things that were listed for a vet tech, I had to do all those things too. If I walk by a kennel where an animal's made a mess, I clean it up. It's not just the vet tech's job, not just the assistant's job. It's all of our jobs to take care of those pets. So very important to find that good teamwork. What's something that you notice about this picture? Let's see.
A lot of women.
A lot of women, exactly right. And I just chose this picture randomly, but it is a very good representative of what veterinary medicine is right now. Our vet school class is about 80% women. And that it's been a trend since about the mid-'80s. I looked it up because I didn't really know the statistics on when I graduated, and we have more women than men in 1995 when I graduated, and it's just continued to go up. Good or bad, I think it's great. But that's another thing you have to think about in veterinary medicine. You're going to have to work with women, and most of us have a great time together. But you do have to think about that aspect of it too. Okay, any questions about vet tech versus veterinarian? I wanted to give you some updates on College of Veterinary Medicine. So any other questions? Yes.
So I heard you talking kind of about a balanced student, and I know that these fields are highly competitive. And so obviously GPA is really important and ACT scores are important. But what else is important? Other than maybe volunteering, but what are some things that you're looking for in your applicants?
Sure, absolutely. Yes, grades are very important, and it's the documented academic ability. I've taken all these really hard science courses, gotten good grades, but the exam students have to take is the GRE, the Graduate Records Exam. That score matters too. So those are the two things that we look at in order to decide who's even going to get an interview.
And the GRE is taken while you're in your undergrad, correct?
Yes. Mm-hmm. Yep. So usually after 2 or 3 years of undergrad is a good time to take that GRE. And I'll just say about the GRE, there are prep courses, there are practice tests. I strongly encourage students to take a prep course, take some practice tests before you go in and take that exam. And I have the statistics in here, but our classes score an average 50th percentile or higher on those exams. So many students don't really know that. We have a statistics page on our website, but I don't know that they find it. And so they take the GRE once and they're just like, it's just a requirement, I just have to take the test, but don't really know how we look at those scores. So taking that test and doing well on it is important. So yes, academics are very important, but so is being a well-rounded member of your society. So you can see on there on our prerequisites, of course, the speech and writing, but also we require social sciences and humanities, and then electives. We want you to come in with a good, broad knowledge of the world and other things. Because every client you're going to see in your hospital has a different interest. And if you have something that you can talk to each one of them about besides their pet, it's a great way to build relationships. Also volunteering in your community, very important, not just at a humane society or in a vet clinic, but just doing anything for other people. That's what we do, right? It's a service industry, and we spend a lot of time taking care of people because animals don't come in by themselves, right? They all come in with an owner, right? So it's really important to work on those interpersonal skills also. And experience with veterinarians, with animals, we don't have a minimum number of hours that we require. There are some vet schools that do have a number that students have to reach, but we don't. But absolutely volunteering with a veterinarian and having a good idea what you're getting into. Everybody's dreamed about it, but if you haven't worked in a hospital, you don't necessarily know what all goes on. So it's really important to get some direct experience with a veterinarian. Plus, we do require a reference letter from a vet, so it's a really good idea to have a good relationship with a veterinarian so they can write you a good, strong reference. Does that answer your question? Thank you. Anything else? Okay, well, this is one of the most exciting things going on. This is the 3rd floor of the College of Veterinary Medicine, Trotter Hall. This is where our first-year students spend their life for that year. And it's just undergone a major $5.1 million renovation. And I'll say, any construction that goes on at the vet school is all donations, bequests, that kind of thing. None of it is tuition dollars. I'd like people to know that. But it's a beautiful, beautiful facility. We have several things. This is a student success center. It is not a lounge. When I first thought, I was like, oh, it's a lounge. And they said, no, our students don't lounge. Not much time for lounging, but there is time for success. So it has a little kitchenette, lots of little tables, places where students can have lunch. They can take a little break from studying, and then they can come into the lab. So this is the anatomy lab here. And this is, right now they're calling it a multi-purpose classroom. I don't know if they're going to change that or not, but lots of things go on there. Each one of these tables has its own monitor, plugins for microscopes, so students can collaborate, and everything is movable. Everything's on wheels, so they can make bigger tables if they want. So it is a great space. This is what it looks like. This is still the kind of mock-up, but it's beautiful. Pretty much that's what it looks like. I mentioned the clinical skills class that students are taking. The first year, or the first floor, sorry, is going to become the clinical skills lab. So this is what it will look like. And we have many models. This is a horse, so students learn how to do palpation. We have other models, practice drawing blood. Pretty realistic. One of our veterinary technicians, she has a history in like theater and arts. She made some of these models, so they look very realistic. I know, not fantastic. Yep. Another really exciting thing at Kansas State is our mobile surgery unit. So this trailer has 2 surgery units in the trailer. The trailer travels around Kansas and to Nebraska. They go to the animal shelters. Senior students it's a rotation, their 4th year. And the senior students who are on that rotation will each do at least 50 surgical procedures in a 2-week period, which is just mind-blowing. When I graduated, I think I maybe had done 3 surgeries. So students getting to do 50 surgeries by the time they graduate, they're going to be able to walk into any clinic and do surgery on anything. I mean, even though it's dogs and cats, surgery skills are surgery skills, and they will feel very comfortable doing a C-section or anything else they need to do on a calf. So anyways, it's a fantastic rotation, a great service that we offer to animal shelters. It is no cost to the animal shelter, so makes those animals more adoptable. It is win-win, so it's a great rotation. We also have a new equine performance testing center. Isn't it beautiful? So there are several things here. So of course a arena, and then some hard service also to walk horses. There are actually monitors we can put on the horses to try to help us determine where they're laying. Sometimes it's obvious, sometimes it's not. So a little technology to help us get to that answer, pretty impressive. They can also take, they can also take x-rays out here, do some endoscopy if needed, so some minor procedures on horses also. How many people have heard of the NBAF, National Bio and Agro Defense Facility? This facility is in the process, under construction. I have heard anywhere from 2021 to 2023 it will be functional. I think the construction will be finished, but then the building has to go through a lot of tests before we can actually use it. The majority of research that will be done here is on foot and mouth disease in large animal. We don't have foot and mouth disease in the United States right now, which is a really good thing. It's a very devastating disease. So we are researching that, just trying to make sure that we're prepared if that ever does come here. So the majority of the research that's done here is on zoonotic issues, diseases that are spread from animals to humans. So the facility right now is off the coast of New York State on Plum Island. You've ever heard of Plum Island? Mm-hmm. That's where they do all that research right now. So we can see it from the library of the vet school. You can see progress every day. So pretty impressive place. There are 30 colleges of veterinary medicine in the United States. There have been a few in the last few years who've become accredited. So now there are 30. We are the 6th oldest. Our first class started in 1905 and graduated in 1907. So if you ever come for a tour, we have a whole wall of all of our classes that have graduated. So those photos from 1905 are pretty cool. So we've had over 7,000 graduates, veterinarians. We kind of already went over what we do each year. So these are just the things that are important to us and what a student needs to have to become a veterinarian or when they apply. So strong desire to be a veterinarian, of course. Compassion for people, we've already talked about that. Personal integrity and high ethical standards. Why is that important? Why do we want to attract moral and ethical people?
Because they're taking care of the lives of animals.
We are taking care of, we're responsible, right? So absolutely, we have to be honest. We have to be honest with our clients. The other thing in veterinary medicine, we deal with controlled drugs. So we have to follow very strict rules. We have to be very honest about those drugs, keep very good track of those. So that's another reason. Written and communication skills, we already went over. Problem solving and critical thinking. We always say animals don't read the textbooks. They don't know what their disease is supposed to look like. And it's never exactly like what it's supposed to be. So you have to be able to think in a little bit of a different way, solving problems. The other thing is, you know, there might be $500 worth of tests that we could do on an animal to find the answer, but not everybody can afford $500 to spend on their animal. So sometimes we have to pick and choose, or maybe just pick parts of tests that we do to try to get a diagnosis and figure out what the problem is so we make sure our treatment is correct. Bettering society, our community, we've talked about that. Get out there and help your neighbors. Understanding of the world and its culture. You know, veterinary medicine is not just K-State, it's not just Olathe, it's not just Kansas City. We need veterinarians who have a global aspect, like we talked about for that One Health. People, animals, our environment. Documenting strong academic ability in the sciences. That's why you see the classes listed on our prerequisites. And lifelong learning. The research always keeps going. It's a race sometimes to keep up with new procedures, new drugs, new medications that are out there, new diseases, for heaven's sakes. At least in Kansas, we are required to get a certain number of hours of continuing education every single year. We need to go to meetings. We need to keep learning about new things. Veterinary technicians are exactly the same way. They also have requirements. They need to go to those meetings too. Continuing to learn, continuing to be better, because we want to always be able to provide the standard of care, that required standard of care to our patients. These are the prereqs that you have there, but for anybody else to see, so of course the composition and speech, chemistry 1 and 2, organic chemistry and lab, general biochemistry, physics 1 and 2, biology, microbiology, genetics, and then there are your electives and social sciences. So that's where we get the 64 credit hours that need to be completed before a student would start vet school.
May I ask a question?
Yes.
On that list, I think it said that you can transfer. Is it recommended though, one way or the other? Even though you can, is it better to take chemistry 1 and 2 at K-State?
Well, no, not necessarily. I mean, I wish I remember the number. Dr. Elmore he has a little number, statistics of how many transcripts from how many different institutions. I want to say it's 700, but might be more than that, that we look at every year. So no, the college you've gone to does not matter to us necessarily. AP credits, as long as they're on a college transcript, we accept those. Test outs, any of those, honors classes, those sorts of things. Now, as far as what will transfer to the university for like an undergraduate degree, I don't necessarily know that, but a K-State advisor could certainly tell you those answers. But no, as far, the only time we do require that is for the early admission program. All of the science courses for that early admit program, those do have to be done at K-State.
Sure.
But now the electives and writing and speech can be done somewhere else.
Right, because we live in Topeka, so Washburn is our local university.
Yes. Okay, yep. Okay, any other questions about that? Okay. These are just some statistics. So the class of 2021, we had 31 male students and 81 female students. We generally have 112 students in our classes. This year we had 1,100 applicants. So we take 112. It is very competitive. Some of the people, the students, the applicants are so impressive. So it is very competitive. We strive for diversity in our classes. We just don't have a whole lot of diverse population even applying for vet school. So we welcome anybody. We do strive for that. This is the age range of our students. We don't discriminate on that either. We have a 43-year-old woman going through vet school right now. So, but still the average is about 22 years of age. For those students who've gotten into vet school, like I said, their average GPA is 3.5, and that's just on those science courses. The GRE, I always say above the 50th percentile, but you can see our students are even above that, 60s and 70s. Some of them do have bachelor's degrees, so 89 students had bachelor's degrees. 5 students actually had graduate degrees, so they've gotten a bachelor's degree and then either a master's or a PhD before coming to vet school. But 21 students did not have a degree. They did that 3-year, got their prerequisites done, and got in early. And there's our beautiful facility. That's nice. Isn't that pretty? So that is what I have. Any other questions?
We have a couple questions that I typed in.
Oh, yes.
If Martha wants to read them since I'm horsey.
Oh, yeah. Do you have it in the chat window, Kelly?
Yes, yeah, that'd be great.
Okay, that's what I will do then. Go to here. Here's chat 2. All right, so from Blue Valley Caps, the question is, can you reiterate the difference between diagnose and prognose, please?
Absolutely. Diagnose is when we've done a physical exam and we find something abnormal, we will diagnose a mass. Or we've done blood work and we have evidence to support that animal's in kidney failure. That's a diagnosis. A prognosis is if we say this animal they've been in kidney failure for a very long time and their prognosis is poor. No matter what we do, they might not survive. So does that make that a little more clear?
Yes, thank you.
Okay.
Your second question says, is it only K-State that offers a retroactive bachelor's for veterinary students if someone completed 3 years of undergraduate before going to vet school?
For Kansas State, those students who we will do that reverse transfer for have to have been enrolled at K-State. So we will do reverse transfers from the vet school to their college and undergrad. College meaning College of Agriculture or College of Arts and Sciences or whatever college they're enrolled in, and then Kansas State will give them a bachelor's degree. But as far as if someone comes here from the University of Missouri and they get into vet school a year early, we don't offer that same thing to non-residents. They have to have been enrolled in undergraduate at K-State and then go to K-State vet school. Does that help?
Yeah, thank you very much.
Okay. Yes, you're welcome.
Are there any other questions from Blue Valley?
We have one more.
Okay.
What are some other vet schools kind of regionally? Texas, Colorado, Missouri?
Yes, Texas A&M, Oklahoma State, University of Missouri, Colorado State, Iowa State, Minnesota. So there are several regional. Not every state has a vet school. One thing I didn't mention, we do have a contract with North Dakota because North Dakota does not have a vet school. So we have 5 positions in each class for students from North Dakota, but we don't always fill all of those. But we have those available.
So I know this is kind of a general question and you may not really
That's okay.
want to answer, but
I'll try.
cost-wise, so you kind of gave us these costs that are a resident per year versus a non-resident per year. Like specifically like for the state schools, is this kind of on average about the same as what, an Iowa State, a Texas, Missouri, is kind of about the same per year cost?
Yes, like I said, we're kind of middle of the pack, but there's a lot of people right in the middle of the pack, very similar tuition as what we have.
So it does make a big difference, right?
It does. It absolutely does. Yes. Yeah. One other thing I wanted to mention is April 7th. We started saying that April 7th is the open house. It is a great time to come to get a tour of the vet school. Our students actually put on the open house and lots of displays out. All the clubs are there. We have lots of different animals. The Sunset Zoo is actually going to be at the vet school this year with some presentations.
So that is so because sophomore day is the Friday night before, and then that day is on the Saturday, right?
Yes.
Saturday. So like if they want to come for like the sophomore day, then just stay overnight. Then specifically at the vet school,
It's on the entire campus.
Yeah.
But yes, I think it's from 10 to 3, I believe. So yes.
If you wanted to do a tour while you were there too.
There will be tours. I think they are
Just
every
yes,
15
on
minutes.
okay.
Yep, there are tours. You can see the whole facility. The new anatomy lab will be open. Yeah, be a great day to come.
What about like scholarship opportunities that might be specific to vet school K-State?
Good question. So yeah, we did talk a lot about tuition, but not really about how are you going to be able to pay that back. I mean, or help support through that. So yes, we do have scholarships at the vet school. Last year we awarded just over $1 million in scholarships. So we do work hard to supply scholarships. Some other routes to pay for school. The military actually has a very, very good program. They support students while they're going through vet school, and then I believe it's 4-year commitment after vet school, but for no debt. pretty awesome offer. There's also a public service scholarship. So if a student graduates and they want to go into shelter medicine or they want to work at a university, those types of public service jobs, I'm still so new. I know it's available. I don't know how many years you have to work in that public service, but after so many years, actually the rest of your debt is forgiven. If you make minimum payments for those first years, then the rest is forgiven. So that's another great opportunity for paying back student debt. Those are the two big ones I know of. Oh, well, no, I know two more. Kansas, the state of Kansas also offers scholarships to students who are interested in practicing in rural areas. And actually almost every county in Kansas qualifies as needing a veterinarian. So that's another opportunity. And then actually the federal government also offers that. And as far as I know, every state has that through the federal government. So
And what's the premise of the federal government?
also serving an underserved area.
I'm sorry,
Providing-
underserved areas. Okay.
Good question. Yes.
So this might be silly, but
Never.
if you've been accepted into the vet program, why would it be important to get a retroactive bachelor's degree?
Because life happens.
Just in case you don't finish.
So, you know, if you aren't able to finish for,
Right.
you know, whatever reason,
Right.
you have a backup plan.
Right.
You have that plan B. I would not want to see a student go through 5 or 6 or 7 years of school and not really have a degree to show for it.
Right.
So I feel personally that bachelor's degree is very important.
Right. What's your rate once accepted, then graduated? What's the percent?
Oh, very high.
I would say once you're in,
Yes.
you probably.
Yeah, I don't know the specific number, but if students do struggle, and we have some great mentoring programs also. So a first-year student has a second-year buddy, a fourth-year buddy, and a faculty mentor from the very beginning. So we have a good support system. Dr. Elmore, who I can't say replacing, but whose position I'm taking part of, his job is actually being split into 3 people. So we have an associate dean of student affairs, and she looks at grades every week. She catches problems early. She communicates with those students, gets them on a plan, gets them set up with a tutor. So we do also have students who volunteer to be tutors, and actually the college pays them, but the student needing the tutoring does not pay anything for that service. So we don't want people to come to vet school and not succeed.
Right.
So we do everything we can to help them be successful. There are times when, you know, if they are ill or if the family member's ill, I mean, there are certain situations where they just can't come back to school. We make it available that they can come back the next time those classes are offered. So there are students that it takes them 5 years to get through vet school, but that's better than not having that
And I'm
chance.
assuming due to the intensity, most of your students do not work outside of school.
Right.
School only.
Right. There are students who do, and I don't know how they do it, because really being in a professional school is a full-time job. Some of them have occasional babysitting jobs. We do employ student ambassadors, and that's a great way for students to work during school. A lot of them will give tours of the facility over their lunch hour, and they get paid for that hour. They help us during interviews, and they get paid for those weekends that they work. So that is a great way to have a job, but not really outside of school necessarily. So there are people who do it. I don't know how, but there are people who do it. But yeah, those 4 years of professional school, that needs to be your priority and pretty much your life.
Right.
Yeah.
And K-State does not have the tech program.
No, we don't.
That would be, you said there was one school?
Yeah, Maple Woods, somewhere in the Kansas City area, I'm not sure. I just know the name and I know they're in Kansas City, that's all I know. But I know there are several in Wichita. Colby Community College is probably the best known in Kansas for having a vet tech degree.
Thank you.
Yes. Anything else?
Well, we have some time to take pictures with Willie. I also have verification slips in case you guys are collecting E-hours or extra credit for your science teacher. So I'm gonna just go ahead and say thank you to Dr. Rost for coming and being so enlightening.
Thank you very much.
Thank you.